Hello and welcome on this episode of Hub podcast. This podcast we bring to you in association with Manipal Hospital's Dona Paula. Now, there is one kind of doctor whom you think you might not require him at this point of time, but you never know. Next second is the person who's most wanted in your life and you rush to him, and that is orthopedic.
In association with Manipal Hospital's Dona Paula.
So we have with us Dr Sushanth Mummigatti, orthopedic surgeon from Manipal Hospital, Dona Paula, and you are also trauma surgeon.
Yes, sir.
Why I said all these things is that right now I'm sitting properly. I know I don't require you, but you never know. Next second something might happen to me. I might fall down and you become my god. So what are the kind of orthopedic cases that you have encountered in your career?
Sir, orthopedic cases as such we divide into two types. One type of cases are called as trauma cases, where we handle injuries either with an accident, twisting injury, footballing injury. The second type of cases we call as cold cases, or something related to knee replacement, spine surgery, arthroscopic surgery, cancer patients, those kind of things. So this main the what we learn when we are learning is both of them together, and primarily trauma. Trauma means those accident related cases where we handle fractures along with the other things also, but primarily concentrating on trauma.
Okay, so right now, since the time you started working in Manipal, what are the typical cases that you have encountered?
Sir, as a trauma surgeon, all type of cases that they come, you can name the fractures from the entire limb, upper limb or lower limb, from the shoulder to the finger, hip to the toe. We have a specialized spine surgeon who handles a spine injury type of cases. So the most common cases, if you ask me, will be the fractures in around the wrist joint and around the ankle, where one person is walking with the water in there or uneven ground, where they twist, and even they twist and fall, or they miss one step and they fall down and they get an injury to the ankle, which subsequently when we get an X-ray done, we get to find that there are small fractures around. So these are the most common way a person will present.
So these are trauma? These are trauma cases?
Trauma in the sense accident or injury.
Injury cases. They come in your emergency
We get in emergency, sir. Yes.
Okay. So usually you are handling accidental cases in your emergency department,
Yes,
or
sir.
you have the cases wherein I've even heard someone was walking and then he had his knee dislocated.
Plain walking should not have a knee dislocation, sir. In the sense, knee injury can happen when you walk on an uneven ground, or you miss a step, you twist your ankle, you twist your knee. That can happen. Plain ground walking, dislocation happening is rare. So it can happen in children where the patella bone, that is small kneecap bone on the front, can dislocate when they are playing. So that can happen.
Now, joint and spine issues are very common in Goa, and I think even nationally that is
Yes, sir.
Is there any specific reason that we have these issues?
If I have to divide it in the age group that is there, for example, if a person, I am seeing an elderly person, joint pain and back pain is something that is very common, and it is universal. Almost every person at some point of time will have back pain or knee pain. Say the most common causes for that is spondylitis problems in the back and arthritic problems in the knee joint. They're the most commonly encountered things, although arthritis can happen in any other joint. So for those kind of age group, arthritis and spondylosis will be the cause for that back and knee pain. In a young an young adult who is very active, who is involved in some kind of sport, we can have knee pain and back pain if they get injured. So for example, a person is a footballer, more commonly in Goa, a runner, a person who runs, so they will have knee issues. When they run, they twist their knee joints, which can cause some amount of ligament injury in the knee joint, some swelling in the knee joint. Or if a person is going to gym regularly, he may be lifting weights and can get back pain that is there. So these are according to the age group. The reasons are different, but they are common problems encountered in both the age groups.
How do you differentiate between your pain due to exhaustion and your pain due to orthopedic disease?
In the sense, if the pain is first is onset of pain, we ask history. How did the pain start? Say if a person has worked a lot of activity for the day, and at the end of the day he is having some amount of back pain, it is expected because of the work that is there. And with the typically those kind of pains go away with rest. So just amount of rest, maybe some household remedies like some hot fermentation, a bit of gel application, these kind of things, if settles the problem, then it is something that is we attributed to fatigue or some basic very minor injury. If something in any orthopedic related thing is slightly more serious, these initial things will help them, but complete recovery will not be possible. So generally the way they present is that I had a back pain few days back, I have taken some medication, some exercises I did, but they have not improved. This is how they present. So those kind of injuries where the initial household remedies which a person has already taken and it is not improved, then we will have to examine him further. There are some signs and all those things which I examine, I can pick it up. So I can attribute it whether it will require an X-ray or a scan, ultrasound or an MRI to be done, and accordingly we advise the patient.
So in case of pain or especially back pain, how many days we should bear before we actually come to a conclusion that I need to consult a doctor?
So first and foremost thing, you should understand how did the back pain start. That is the most important thing, history. Say if you give an example that I did my daily activities, maybe a bit more today, and that is causing me back pain, I can still wait. I have not done anything out of the normal thing that I have done. Say if the same history being, if I am a gym going person and when I was lifting something heavy, I suddenly heard a pop in the back or the pain started at that point. This is one of the history that differentiates where you will have to consult a doctor quite early. The second most important thing which I will want to tell you that if a back pain is only confined to back, then we can still wait and see. If any time we feel that the back pain is in the back and it is also coming down like an electric shock like sensation or an radiating pain, what we call it is coming down to your legs and the toes and fingers are becoming numb, that is something that requires urgent medical attention. So this is a condition where the back pain can be associated with the nerve getting pinched because of disc problems. This can happen. So that will require hospital visit.
So that's a disc problem. If something happens in your back and you are feeling it even in
the toes or the leg or the foot, that's a very classical way of presenting foot problem, but it can be much more milder versions also.
So in such cases, can you go to a general physician and then come to orthopedic, or you have to rush to the orthopedic first?
In Goa, the availability of orthopedician is quite easier, so you can directly meet this thing. Even if you go to the general practitioner, most commonly the prescribed drug will be a muscle relaxant. If the things get settled with muscle relaxant, it's good enough, not a problem. But even with muscle relaxants, things are not settling down, it is persistent pain, then you'll have to visit. Few things, there are some clinical findings which are there which will require further investigation. I am sure the physician will see that there is weakness of the toes, there is numbness of the fingers and toes that is there. So that will require an orthopedician to be seen. If it is just a back pain and some amount of pain here and there in the leg, we can get it treated.
We have seen many people taking massage and then it goes wrong and then you end up having your ortho problems. Is it very general these days? Yes, sir. It is common. It is not that massage is wrong. It's just that what condition for which you are taking. As I said, fatigue can get relieved better with a massage. If there is any proper orthopedic condition, it is better get evaluated first and then go ahead with those things. So, who's the right person? Which massage guy you should go? Is there anything wherein orthos would suggest you should go
sir, whenever we have these kind of issues and say the initial treatment has the most common way a person presents is a pain in the back. So we have to reduce that pain. We generally use some medications for the initial few days to reduce the pain. Say when we control that pain, next we send it to a physiotherapist. Then they will teach them exercises and maybe some local remedies, local therapies that will help you to this thing. I will not consider it as massage, but of course there are certain therapies such as ultrasound therapy, TENS therapy, short wave diathermy therapy, where the pain is reduced with the therapy that is being given. Along with that, they will teach some exercises which will relieve back pain and strengthen the muscles of the back. So the back pain will reduce for this episode, and also if you continue this exercise regularly, in the future the back pain may not come. Even if it comes, the intensity will be less. So that can be learned with a physiotherapist. Some people also go for self-medication.
how
Sir,
bad it is. I won't say how
sir,
good it is.
preferably meet a doctor and take it, sir. That is there. If a minor amount of pain, a paracetamol tablet someone takes, that should be okay. But it should be ideal thing should be you should meet a doctor and then take the medication.
How long you can take painkillers and keep on delaying visiting doctors?
So there is no limit to it, no. In the sense you have to come early as possible. If the condition is severe, if the very fact that if you're taking the medications more frequently, it shows that condition is not getting treated with the medication. That will require someone to see it, even if it is a GP or an orthopedician. It has to be evaluated.
So orthopedic, all these diseases are also lifestyle related diseases.
Some of them are lifestyle related diseases, yes, and some will be purely injury related diseases. Any condition when we treat with medications, we treat with exercise. Finally, when that episode is over, we give them regular exercises. The intention is to change their lifestyle to an extent where the muscles which are concentrating on should be strong enough that it will not trouble them future in the thing. To say an example, if I am advising someone for a back exercises, my intention is to reduce the pain of this episode and to make it strong enough that the next time that they will not get it back. In this, we also advise something called as safe back practices, like if something falls down, how to lift it the correct way. If I have to lift a weight, how to lift it a correct way. All these things will be taught by a doctor or a physiotherapist when they come for that consultation.
These things also should be taught in school, don't you think?
That will be the most ideal thing, sir.
So that they don't lift
Yes,
it in
sir.
wrong way and you don't get into
Yes, sir.
problem.
And that is almost coming to that. At least now most of the people know that we should not bend forward, lift heavy weights. We should lift with the knee when a person is having back pain. With their waist also. So those things have come there, but if it is an official way we put it in, it will be much more better.
For orthopedic treatment, Ayurveda or any alternate alternate stream of treatment also works?
If it is in condition that is more acute, say for example a fracture and those kind of things, generally it is said that allopathy works better. We have seen patients where they have taken the alternate form of medication. Some have got good relief, some have got not. So when they come until they tell that they have applied some local applications, and for some it had got relief, and for some other people it has developed a reaction or the main symptom has not gone. This can happen, sir. There is no fixed thing that you have to go to this thing. You can try the alternative. There is no this thing. But if you come to an allopathic, the decision or the investigation will be thorough.
Okay, now next question I am asking in Hindi because I will
Yes,
be
sir.
able to ask you in better way, because this is a curiosity that I have since childhood also.
Yes, sir.
We have seen when we were in village, हम गांव में जब थे तो ऐसे कहा जाता था तुम्हारा अगर पेन है तो जो बच्चा पैर से जन्मा हुआ है या समथिंग लाइक दैट कंडीशन, उसने अगर अपने टो से तुम्हारे पीठ के ऊपर ऐसे कुछ ये कर दिया टच,
Nothing.
तो तुम्हारा पेन कम हो जाता.
Nothing related, sir. Nothing related.
It's
to it.
not scientific.
No, sir. No, sir.
Just a belief.
Yes, sir.
क्योंकि वो भी होता था.
To be frank, I have not heard it, sir. मैंने सुना नहीं है.
हमारे इसमें होता
हाँ,
था.
sir. नहीं है, sir. There should not be a medical thing to it.
So, okay, now when you see someone who has met with an accident on the road
Yes, sir.
and you doubt that he has a fracture, I have to bring him to the hospital. What is the first thing that I should do?
This is the most important question, sir. Whenever it is there, as a first responder, as a person that is there, it is usually taught in a paramedical, the training that they give, that is there. Any part, for example, I'll take an example of the leg to explain it to you. Any part that is injured, say leg is injured, first thing it has to be immobilized. So whatever the injury that has happened should not further be injured by moving it. So it has to be immobilized in whichever form that is possible. So for a leg, we have a splint which to hold it. If it is not possible, if the paramedic or the ambulance is not able to reach, at least 2 sticks together to make sure that it is immobilized in a way where further injury is not caused more than what it is there. That is one thing that is there. Preferably bring the patient in a lying down position so that even if the spine and head injuries are there, they can be taken care of. The ideal way is to get in an ambulance. Even if it is not possible, you are getting a vehicle through it, the logic should be that it should be immobilized. If it is possible to get an ice pack to apply on the injured area, that will be second best thing that can be done.
How do you know that you have when there is a ankle pain, for example? How do you know when there is a fracture, and how do you know it is a minor ligament?
Yes, this here first the history helps, sir. Say if I expect a person is walking and he is twisted and fallen down, I expect it not to be a fracture, it to be a ligament injury or a sprain, something like that. If a person is fallen down from the bike, so what I am trying to tell is a high velocity injury. A high velocity injury can have fracture plus soft tissue injury, that is the ligament sprain that is there. So this gives me some clue. Second point is examination. I will press his bones and ligaments. We have certain examination way to test it. When we test that and I press a bone and he has pain, so that indicates that the injury to the bone is significant. So that will give me some idea to whether fracture is there or not, and I'll advise further an X-ray to see what is there. If it is a minor sprain, the amount of swelling that happens, the amount of pain that a person experiences is less. Usually they come walking, although pain is there, usually they are able to bear their own weight and come. But when there is a fracture, it will be almost impossible to bear a weight. Very small fractures of the toes, a small finger, that a person can take the weight, or else the person will not be able to bear weight at all.
Secondly, now with invasion of technology, has it become a little easier for you to treat patients with the technology?
That is ever growing, sir, in the sense, if you ask me, in the sense the type of imaging that we are doing. So for example, the MRI, I am not saying it is recent, but the MRI, whichever the way it has come, compared to the time where my consultants were studying, it was not there. So in that, now we are able to pick up injuries, smaller injuries, more clearly. So when we go into a type of treatment, the amount of outcomes we get it better. So for example, just to put things into perspective, in olden days, like in World War I, World War II time, if there is a fracture of the leg and the bone has broken and come out, say it's called as an open or a compound fracture, the one of the most accepted treatment was to cut off the leg in that time. So now we have come to a place where even on the day one, we have got fixators, we have rods and plates, where the outcome of the surgery is very good. Most of the people will be able to retain their leg, walk better, and get back to their previous activity as close as possible. And the duration of treatment also has reduced, means the bone healing time that has improved. The quality of implants or type of implants that also have improved, sir. Initially, if a fracture was there, we used to put a plaster or put a rod that is there. The nature of rod, now what we use, the design has been much more better than what it was before. So which allows us to make the patient walk on day one. So he can get back to his activity, at least to the washroom back, and those part can be attained quite early. So these things have improved with improvement research papers and all those things.
So now also you have robotic technology to operate a person?
Yes, sir. In Manipal Hospital specifically, right now the robot is there. We have a robotic, the robotic assisted knee replacement surgery and hip replacement surgery. That's what is the robot for, where a robot helps a surgeon to see the things which are there, help to plan the surgery more accurately, take the cuts and all those things in the bone, and surgery is done much better than what it would have been done with a normal person without a help of a robotic assistance.
So this question I always ask whenever doctor comes.
Yes, sir.
Is it advisable for someone to go to a gym? Because many a times gym, does it strengthen your bone? Forget about muscles. Does it strengthen your bone or it weakens your bone?
Sir, I'll start it one step previous to that. How do we make our bone strong, if you ask me? So one is, we all say, do exercises, you will become strong, and eat good food will make you strong. So 2 ways to do it. So it is well proven fact that whenever a bone has to grow, either by length or by width, means it has to become strong, it should have some amount of pull from the muscle, muscle that is attached to the bone, that acts as a stimulus for the bone to grow. When a person loads, when a person walks, in the loads of loading, a different bone has a different way of loading. Say for a person who is of the leg, when a person walks, it is loaded. So when you give that little bit amount of stress to the bone grows, the bone becomes more stronger. So in that sense, if you see, exercise is required for muscle to become strong as well as the bone to become strong. It is both of them together. This is one part of it. And the second part of it is nutrition.
Exercise means lifting.
Exercise can be of 2 types. One is cardio exercises, which involves you in burning calories and all those things. The second is weight based exercises, where the strength of the muscle is increased. Both of them contribute. If you say the contribution to what level it is to be 2:1 or 3:1, where lifting weights helps much more faster and better than the cardio type. But both of them do help for bone and muscle health.
Okay, you're saying something else. No, you're saying something else, and then I stopped you.
Now the muscle strength.
Muscle strength.
In the sense, for the bone to grow, that stimulation from the muscle is required. Some stress is required for the bone to grow, along with the nutrition that we take. So in that sense, going to gym, even in gym, what you do matters. say if you are a person who is having so the good what to say balance in gym should be, we should have both cardio based exercises and weight related exercises. Both of them should be together, where we can divide it into say for 1 hour if we have a gym session, say 40 to 20 minutes, 40 and 20 we can divide it as, where 40 minutes we are going for weight training type of exercises and 20 minutes for cardiovascular exercises that can be done. So we are making sure that the heart rate is big enough to get those blood supply going and that fat burning process, and also we are going to train our muscles and bones to a way that they become more stronger.
There is also a trend to consume protein powder when you go to the gym.
Yes, as such protein powder, not even for the gym, even for the normal this thing is very important, sir. The basic logic being, for our bone to grow or for our body to grow or be healthy, there is a certain amount of protein that has to be there. So for example, a person is 80 kg say, so 80% of that will be 60 to 70 gram of protein will be is an absolute must for normal person to have. If a person is going to gym, his requirement slightly increases. So this has to be met with our food. So if you are able to generate it with our own food, like any non-vegetarian type of food, eggs, and even vegetarian food including paneer, tofu, any good protein source based diet we are having, and we are able to meet that need, it's good enough. For those people where the natural way of getting that food is not available, then protein comes to play. So if a person is able to get it through a natural source, there is no role of protein per se.
It is always advisable to take it in the natural source than
yes,
having
sir.
a powder.
Yes, that is always the case, sir.
When it comes to vitamin D, now when it comes to women, correct me if I am wrong.
Yes, sir,
vitamin D deficiency becomes a major problem amongst women, especially when they are adult and they,
correct,
because of the age.
Correct, sir.
So what is your recommendation for them?
So for that you have to understand how a vitamin D works. So we have the way the body produces vitamin D is that the cholesterol in the body, under the skin, with sunlight changes itself to vitamin D, and then that is used by the body. What does a vitamin D do? Vitamin D helps in absorption of calcium from the gut. It helps to deposit the calcium from the blood to the bone, so it maintains the bone health. So per se, one word to be told, vitamin D helps to bone to become stronger. So now this bone becoming stronger, this process is a lifelong process. So vitamin D is required for the entire life. There is no change to it. So the most natural way of getting it is to have sunlight exposure. We recommend early morning or late evening sunlight, where 20 minutes to half an hour per day, which is quite difficult for any person to have. Means we are all busy in their schedule, so generally to get difficult to get. So by this reason, amount of vitamin D in the body is generally considered to be low. So we have to supplement it as and when possible. And the ideal way of doing that is to get a vitamin D3 level in the body done, and we have values. The normal value should be somewhere upward of 30, and if it is low, then we have options available in either an oral form. Okay, it can be a syrup, tablet, powder, whichever form, or if it is very low, in the form of an injection. So either which ways we can give. So when we bring it up to a normal level, say normal 30, say consider it is to be 30, so we cross that normal level, then we can maintain that vitamin D by taking it regularly, once in 2 months, maybe a dose of vitamin D, 60,000 units. We get it in a form of a small capsule, tablet, or this thing. We can continue that, sir.
What do you recommend for good bones, cycling or walking?
Cycling is where it is an closed loop exercise, sir. It will load the bone more than walking, so definitely cycling better than
cycling
walking.
Is better.
Yes, sir.
Okay, last and important, for those who are senior citizens, they have to take care of their bone. Now tell me, which is the age where the bone stops regenerating itself, or recorrecting itself?
Sir, if you ask me, means the bone remodeling means the
bones means if there is a fracture, then the possibility of recovery is faster. Which is the age?
Sir, if I have to tell it in a sequence, the peak strength of a bone we all reach is somewhere around 18 to 19, where with child, as a baby, when we are there, we are growing, with 8 till 18 years of age, our bone grows the strongest. From there we hit a plateau. So we hit a plateau, and it's around 40 to 45 years of age where that strength of bone is maintained. Although it could be a slight decline, but it is maintained till there. After 45 to 50, it starts declining. In females, the decline is seen much more faster after the age of 50 to 55, some hormonal reasons. So it can decline more faster than what a male can experience. So till 18 is the only upward curve. After the 18, either it is flat or it is coming down, the strength of the bone. So the need for us to correct, or it is a after 18, it has to be very regular thing. It is not that at this age only it is there, but 55 and above, it is considered that the bone strength reduces significantly. Although there are different factors associated, that age matters, sex, male or female matters, your physical activity level matters, what we eat matters, what is our weight matters, all these things considered together, or associated conditions matters, all these things considered together. 50 to 60, after that the bone starts becoming weak, and regular supplementations will be required.
So who's the oldest the patient? I'm asking about the age you have operated.
Sir, in Manipal we have operated around 97. We had a hip fracture 97. We made
97.
them walk. Yes.
You can walk after that.
That is the main idea. The patient has to be fit, and we have done it.
Acha. So
Yeah.
there is no limit. There is no age limit.
How we decide? The most common way elderly presents is with a hip fracture. So a hip fracture is something, if we don't treat it, the patient becomes bedridden. And bedridden patients, things can go wrong very fast. So there are so many things that can go wrong, including a bed sore getting formed in that region. So for that reason, for our main aim is to make them upright and walk. If a person is already walking, say before the fall, whatever the age group is there, if a person is say 80 years and before that fall the person was active walking under, then we should give him a good at least chance for him to get back to that level. So for that we will have to say, in case if it is an injury which is making him bedridden, we should make sure that we treat him in a way where he can get up and walk. So now that most common way a person presents is in hip fracture. We do hip replacement, or those fractures which require rod placements, which we do, and make them walk early, so that complications of being a bedridden patient goes off.
Okay, last question. Why we should come to Manipal when it comes to orthopedic treatment? Why not any other hospital?
Sir, it's a doctor-based hospital where Manipal Hospital offers 24 hours emergency. Any doctor that you want will be available on the call. And our hospital handles all cases in an advanced way. If I have to tell you an example, the knee replacement, you would have heard of it. We have a robotic system to do that. Hardly one or two hospitals in the entire in the Goa have. If you consider spine surgery, we have a surgeon who does it in an endoscopic spine surgeon. The same thing, being hardly one or two hospitals in the entire Goa does have it. If you come to trauma, an orthopedician will always get 24 hours there being there on call, so he will be there to treat you. So that is the best possible thing that we do, and we'll take care of him very well.
So life is on when it comes to Manipal Hospital.
Yes, sir.
Thank you, doctor.
Thank you so much,
for being with us, and we hope that you don't have to consult doctor, but you never know. Sometimes it so happens that you have no other options, and then you can always visit Manipal Hospital and meet the doctor. But with in case of emergency, no appointments at all. But if you feel that you have some kind of pain in your joints, in your spine, then it is always advisable that you should take his prior appointment and meet and rule out that this is a major problem. It could be a minor problem. You're watching Hub Podcast on your favorite channel, Goa News Hub. Keep watching us.